Cairo, Seattle. This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo.
Today, we're talking about the small business owners who are defying Washington's stay-home order.
The first phase of Governor Inslee's plan to reopen Washington starts today, but phase two, which includes businesses like salons, could be still 3 weeks away, and some business owners are frustrated with the lack of a timeline. We heard from Bob Martin, who is in Snohomish County, and he has refused to close his barbershop. Apparently, once word spread that Martin would defy the order, dozens of people in our states waited in long lines for haircuts.
All the barbers need to open up the shop, and don't be afraid. Don't be afraid. I'm not afraid of anything. I'm not going to let that pansy ass tell me what I can do to make a living, because I don't believe anything that they're doing is legitimate.
That was Bob Martin talking to Dory Monson. And, barbershops and salons, again, they won't reopen until phase two. I heard from the governor's chief of staff that won't happen likely, again, until June 1st. What do you make of all of these people sort of not only the business owners who are defying the order, but also the people who are waiting in long lines now and not practice social distancing? They're not wearing masks when they go to get a haircut, for instance.
Well, I hope it works, because it means that the virus is, I guess, less contagious than we think. The downside is that if they're wrong, then they won't be able to get a haircut for a while until they recover. So, right. There doesn't seem to be much consistency state to state in what gets opened first and what we have to wait for. So Georgia opens up the barbershops and some of the restaurants. Other states are opening churches, but not restaurants. I guess you have to trust what local officials are saying. But this, Aaron, I find this useful in one way, in that these people are running an experiment, basically. Mm-hmm. And we're going to find out in real time what is safe to open and what is not if these things continue. So I probably, at this point, I don't want a haircut bad enough that I would stand in line with a lot of people I don't know. But maybe in a smaller area where you do know most of the people and nobody's showing signs of infection, it could end up being safe. We'll find out. What do we figure, about 2 weeks? 2
weeks, and that's usually how long it takes for symptoms to start showing up. Interesting timeline, though, too, there, because I think that state capitol protest, wasn't that about 2 weeks ago now also? So
right.
I don't know if anybody has been tracking anybody there, but if cases start popping up there, then yes. It's hard to know really how widespread the virus is without knowing where cases are actually developing. For instance, if they're all popping up in nursing homes or in hospitals, then perhaps it's not as widespread as we thought. But as far as I know, we don't have that kind of data readily available yet, right?
No, we don't. For example, there's a big difference between an indoor environment, like a nursing home, and an outdoor environment, like standing in line outside a barbershop. And one of the lessons that our own Dr. Cohen taught me is that the solution to pollution is dilution. So in other words, if you're standing outside in an environment that's full of pollutants, among which would be these viri, then you're probably safer than if you're standing inside where nothing can escape, where the air is just getting recycled. So maybe it will turn out from these various experiments, not just at the barbershop, but around the country, that nobody gets infected standing in line for a barbershop. But the only thing that would argue against that is that in the notorious Wisconsin primary, where people stood in line to vote for hours and hours, there were clearly cases of the virus that could be traced back to that. So again, it's a roll of the dice, and we'll see.
A new model from the University of Washington has drastically increased its projected death toll. Here's Dr. Christopher Murray with the UW's Institute for Health Metrics and Evaluation.
The number of deaths that we forecast out to August 4th now increases to 134,000 deaths.
That is a massive increase, over 60,000 more people from their projection just last week. The IMHE says that after states reach their peak, the decline down the other side of the curve seems to be lasting longer and declining more slowly than they originally thought that it would. This actually is exactly what you were saying earlier, Dave, the fact that you've seen the tail sort of spread out a little longer than the IMHE thought it would.
Right. You could tell they're going to have to change the modeling, at least for Washington, because they predicted that we would have reached the maximum death toll by now, which was something like 820 or something. And we're clearly going to blow past that because infections are spreading and there's still more people being admitted to hospitals and not surviving. I'll admit right up front, I'm not a statistician. I consulted with my daughter, who has studied statistics for her own, field of study, and was trying to explain it to me. But the bottom line is that they have added other factors, what they call key drivers. So among the factors they've now added into their modeling is the ambient temperature, basically the weather, the percentage of populations living in dense areas, in the areas that are being assessed, testing per capita, and mobility. The mobility one is what I find very interesting because they're using data collected by Google. Apparently it's anonymized, but you can determine how much people are sheltering by simply looking at this statistical data based on the movement of presumably people with cell phones. And by factoring all these things in, they can fine-tune the model for these various local differences, which are causing very different disease curves. And this is supposed to help local politicians decide when it's safe to reopen or not. But again, since it's so complicated, and since I'm pretty sure, unless you're a statistician, you won't understand the methodology, you have to decide whether you want to trust this or not.
That's what I was just going to bring up. I mean, there were already people who were skeptical of some of the models that our states and that the federal government have been using. And now you see this UW model increase its projected death toll up to 60,000 more than originally thought. If you were already skeptical before, I think you're even further questioning these modeling now.
But let's look at it from the other point of view. The old model was clearly underestimating the number of deaths because it's been exceeded, right? So
yeah.
If people wanted to cling to the old model, they would look silly because the old model would be saying that those thousands of additional deaths you see happening shouldn't have happened. So then, what do you say? The virus gets the last word in all of these tests that are going on.
There is controversy in Ballard after the city of Seattle swept a homeless encampment there on Monday. Now, this is against recommendations from the CDC because asking homeless people to disperse out of a camp could cause the coronavirus to spread to other parts of the city. Seattle says it offered 13 units of shelter to the 15 people who were still in the park yesterday morning, and that decision was made with the health and safety of the people living there in mind, the city says. But the sweep, Dave, was not backed by public health. A spokesperson for the Seattle-King County area told the Seattle Times that their agency agrees with the CDC guidelines. So I guess the question is, what do you do with homeless encampments during this whole coronavirus if there weren't enough beds before, for the homeless population, and now you have, I think it was like 40 people who were living there in the past few weeks. Now only a handful of them get beds. I mean, this is a tough situation to handle.
The difference now appears to be that with the hotels basically out of business, there's plenty of hotel space to potentially move people. My question is, did they take their temperature before they swept the encampment and just scattered everybody? I mean, that would be the smart thing to do, it seems to me. And if somebody has a fever, then get them some sort of medical help, right?
Yeah, another issue here is the Seattle Times is reporting, it spoke to Josh Permy from the Bridge Care Center, that congregate shelters are full. Now, I know King County has purchased at least a couple of motels to try to quarantine people who don't have homes, but we've already not had a solution, a great solution to the homeless problem here, and there still aren't enough shelter beds for people. I'm not sure where to go from here.
Okay, well, the problem with solving the homeless problem, here's the reason we haven't solved the homeless problem. Neighborhoods don't want these shelters located there. That's the main thing. We know how to solve it. It's build housing for everybody. But it is very difficult to locate these housing solutions because neighborhoods don't want them. Now that there's a public health emergency, the government seems to have a little more power to say, okay, we will be sheltering you in this hotel in Kent, just to pick that example, whether the neighbors want you there or not. And, of course, eventually we will have to get to that. If you really want to solve this, you'll have to build some sort of publicly funded dormitory, which is going to have to be located somewhere, whether the neighborhood wants it or not, and people will be sheltered there. Now, maybe it will take homeless people walking around spreading a virus for people for the rest of us to realize, wow, this is a really bad situation. Maybe a good compromise would be to find these people a place to live, even if they have no means of supporting themselves. But I guess we haven't quite gotten to that place yet. And again, the virus has the last word here. Maybe none of this is of any consequence. They will disband these camps and nobody's infected. They didn't bother taking any temperatures, but maybe nobody's infected. Maybe you can wait in a line at a barbershop and nobody gets infected. Maybe, for all we know, we could hold an experimental football game and pack the stadium and see what happens. I guess it all depends on how many volunteers you get to sign up for that sort of gamble. We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast, and you can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.